A very good welcome, a very warm welcome to resilience in the healthcare context. So today we're going to explore over roughly 45 minutes some of the evidence, some of the connections, and some of the practices that help people to be more resilient. We define resilience as the ability to bounce, to grow, to connect, and to find flow. My name is Dr. Sven Hansen. I'm the founder of the Resilience Institute. I started back in the 1990s. I qualified as a doctor in 1986, spent some years in hospital care, then moved into sports medicine. And as I transitioned, I guess, from medicine to being a doctor in the business world, I spent some years as a director of the Auckland District Health Board, serving roughly 1.5 million people. So, as well as understanding some of the sports side, I also have a reasonable sense of hospitals, of private practice, and also of the business environment. So as we go through this, remember that many of the things that we can do that are simple, practical, and inexpensive can have a real benefit. So I want to try and explore both the science and the practice of what we term resilience, or that ability to bounce, to grow, to connect, and to find flow. So let me share just a couple of slides and we'll go through the context, I guess, that we find ourselves as clinicians, as healthcare workers. Our topics for today is to define resilience. How does this fit with this idea of well-being and mental health? To understand there are unique challenges in healthcare. There's ever-increasing demand. There's more and more science. There's more and more pressure on cost. It makes for a difficult environment. To know, as a healthcare provider, what are the benefits of this thing we term resilience training? Fourth, to understand how you, as healthcare practitioners, can benefit from your own resilience skills and training. To understand that this journey of resilience is something that is shared. There are things that we can do as individuals, but it's also really important that we do things as an organization as well. And when the two work together, things happen well. And finally, just a reflection on how resilience can benefit patients. So we know there are many forms of death. You can see high blood pressure, something we can manage with medicine, something we can manage with lifestyle. Is right up at the top. We notice also things like high blood sugar, smoking, obesity, cholesterol, but also the huge role of pollution. And I think, that was my first wake up as a young doctor, is there's an awful lot of work that we do in the healthcare system that could be entirely prevented if we were sensible about the environment and about the lifestyle guidance to people. We have some real changes happening. For me, one of the graphs of the year is this from Jean Twenge, also articulated by Jonathan Haidt, is how risk-taking behaviors have declined massively since I finished school in 1976. So roughly a 50% drop in trying alcohol, getting a driving license, working for pay, having sex, and even dating in the real world. This is a huge change, right? So risk-based behaviors require some resilience. So one must ask, what is happening to our younger generations? We all know that somewhere around 2011, with the introduction of internet-enabled devices and social media, mental health amongst our young people has shot up. And we know it's not just diagnostic, it's actually the behaviors, the suicides, the self-harm that are related to these conditions. So the challenges are real. And I guess as humans, we need to be humble and know that for time immemorial, humans have longed for a magic pill to extend life, a magic pill to drive libido, a magic pill for intelligence. And today's magic pill is, of course, the GLP-1 agonists, such as Ozempic. And it is very easy to abdicate from the practices of resilience and say, you know what, I will just take a pill. So we need to understand that tension. There is a place for good medicine, for good pharmaceuticals, for sure. The case I want to make for you today is there's a good case for understanding what resilience means. Economist has been very, very vocal on how much we should be using Ozempic. I'm going to be more vocal on how we might use resilience. So from Daniel Lieberman, professor of human evolution, evolutionary biology at Harvard University, he has advocated for many years now this idea of disevolution. Our modern life is triggering, if you like, a backwards movement where we're losing our strength, our fitness. We're becoming more ill. We're suffering with mental health. Our jaws and skulls are changing. So we have breathing disorders and real difficulty chewing firm food. Our feet are collapsing, joints are collapsing, short-sightedness, myopia is increasing massively. These are trends that will over time have huge consequences. And perhaps another encouragement to consider what we're going to talk about. It's not always a magic pill. So as I said, our definition of resilience, first, the ability to bounce. When things go wrong, when you strike adversity, self-imposed or external, we suffer. And in resilience, the beginning of the research of resilience was this concept of bounce, that even in the most severe adversity, you can get post-traumatic growth. In fact, it is the more likely outcome. So we tend to encourage people not to use the term bounce back because that's appropriate for an aircraft wing. But as we know, if you exercise a muscle, if you practice empathy, if you focus your attention on a topic, you will actually grow biological resources. So the second part of resilience is the ability to grow our physical, our emotional, and our mental resources. The third part of resilience is to connect with ourselves, to connect with each other, and to connect with the environment we're in. And the final one is what we term flow. That is termed the optimal professional experience. It is when you can be up to 5 times more productive. In the difficult, challenging work of healthcare, finding that flow can not only make work more enjoyable and more productive, but an awful lot more satisfying as a clinician. So we use a diagnostic and development model. There's more on our website. You're, of course, very welcome to take a look at that. Our sense is simple, right? We all know as human beings, there are days we wake up and you feel great. Your life's wonderful, your partner's wonderful, your job is fantastic. You're on top of the world, let's rock. And there are other days we wake up and we feel like death warmed up. This intuitive, basic idea is altitude. And as humans, we have the capacity to be more alert to our altitude moment by moment, day by day, year by year. That we term self-awareness or self-knowledge. Secondly, we know there are many things you can do to lift your altitude, simply changing posture, adjusting your breath from mouth to nose. For example, taking a little exercise, having a good night's sleep. These are all very practical things that can quickly and over time significantly raise your altitude. That we term mastery. The third angle is empathy, to be able to give enough energy to other people so that you can see where they are. When we're treating patients, this is critical. Many presentations in medicine have no organic basis. They are based on the emotions, on the physiological states, and in the mental states of our patients. And if we try to treat those with medicines, we will sometimes miss the opportunity to treat it much more wisely with simple practices. And fourth is the capacity to influence. If you know yourself, if you can master yourself, if you can read others physically, emotionally, mentally, you can influence them skillfully. That's kind of the journey of leadership in resilience. We measure resilience. We use a 50-factor measurement. We have just over 100,000 people who have done this. So we have a reasonable sense of what resilience looks across the world now in all continents, in 7 languages. And here you get a sense of a dotted line, a group of executives before training, and then after training, their post-assessment. And you can see the bell curve has moved in the right direction. And we can also get really detailed about what specifically changes. This is a large thing, a sort of controlled study of 4,456 people. And you can see in the improvement what kind of gains we get. Contemplation right at the top, changes in fitness behaviors, relaxation skills, interestingly, health awareness, going to see your doctor, having a preventive healthcare, sleep, daily practice, and bounce. Right? The longer a program goes, the more we seem to achieve impact on the emotional and the cognitive factors. Okay, so a really useful little thought as you work through this is what really matters. So if we look at the top 10% of resilience scores and compare them with the bottom 10%, where are the big differences? And here is the list from 2022. Right, there's roughly 10,000 people in that sample. And what we see, if you're in the top 10% of resilience scores, 92% of those people are ticking the high score, strongly agree for life work fulfillment. Whereas in the bottom decile, it's 16%, a big difference. Likewise in sleep quality. Sleep quality was never in the top 15 even for prior to COVID. And during COVID, it has shot up and stayed up. Bounces there, focus, relaxation, and purpose. So if you're thinking about things that might really make a difference, and based on a large sample of functioning people, this gives a real sense of what those who are high in resilience are doing as compared to those who are low. So let's follow some of those through in some practical, simple concepts. So flow is what drives fulfillment. How do we know flow as a healthcare professional? Well, the first thing is to look for times when you're super productive. Roughly a 5 times improvement in productivity for a professional is what McKinsey have quoted. How do you identify it? Well, it's those times your thinking stops. You stop tracking time. The morning rushes by, where did it go? It's graceful to a degree. And after flow, there's a huge sense of joy. So the original founder of the flow concept, Mihaly Csikszentmihalyi, died a couple of years back, but worked for roughly 50 years in this field. He had this lovely concept, I think as professionals we can use. There are 2 axes. The vertical is challenge and the horizontal is skill. Flow is that state when your skills are razor sharp focused on a meaningful challenge. All right. When we're sitting down watching TV, that's the opposite. We go into an apathetic state. There's very little challenge and there's very little skill required. So it feels relaxing. But in fact, relaxation, according to Csikszentmihalyi, is when we're skillful, attentive, but not necessarily challenged. So perhaps when you go around and you see your colleagues and you talk about how their day has gone, you are leading by walking about. It is relaxing. It requires plenty of skill, knowledge about people, knowing how to interact with them, that emotional intelligence concept, but it's not highly challenging. Completing brain surgery, much more challenging. The skills are much more deliberate, and you need to get into that pointy end of flow, just like an athlete. But for all of us, if we can raise the challenge, match it to the skill, we enter this really interesting state. And remember, as we go through the day, I think this could be a real little good one. Take a screenshot, track yourself. Did you get some flow today? How much of the day were you relaxed? How would your people have seen you? Were you in control? When did you go into that arousal? Did you flip into anxiety, worry? And clearly, as we get a new job, we cycle around this graph. Hugely useful concept for self-development, for finding joy in your work, and for doing a really good job. In some ways, I think education is all about helping people find their flow. And of course, as we look at resilience, the skills that matter in our view are things like self-care, understanding this flow cycle, being present physically, emotionally, and mentally, to have great empathy and to understand your influence skills. Sleep was the second one that really matters. Now, we all know lots about that. And I think, it's a rich field, perhaps sometimes too confusing. So our sense here is think about simplifying it. Most of us who've worked in the sleep science, sleep medicine area are starting now with the concept of rhythm. Based on your circadian clock, What's the best time for you to fall asleep and to wake up? I can't tell you. But that's a great question for you, for your patients, for your team. There is a perfect time based on your biological or circadian clock for you to wake up and for you to fall asleep. And if we can understand whether we larks or owls, it makes a real difference. So generally, we recommend if people could understand their wake-up time well and to keep that consistent, preferably with 20 minutes of blue light, that's pre-dawn light, to help reset your circadian clock through the eyes, the melanopsin, and the suprachiasmatic nucleus. And equally important is knowing if I'm going to go to sleep at 9:30, what do I need to do to allow for that cooling effect where heat moves from the core to the periphery? That is helped by melatonin. If you're on your device, that blue light will block up to 44% of your melatonin production. It'll also shock your clock, much as jet lag does. And this is why in many sleep studies, the strong recommendation is to wake a little earlier, to avoid daylight savings, and never to sleep in the weekends. Every time we introduce daylight saving, there's a bounce in heart attacks, strokes, motor vehicle accidents, and suicides. The same happens at the end of the weekend. The same happens if you're jet lagged. So having consistency in this clock and working out what that right time for you is the beginning. And then many of the rhythms that we'll finish on automatically will take care of themselves. There's plenty of arguments how much sleep we need, what we call how much sleep do I need or sleep need. That is probably somewhere between 6.5 hours and 8 hours. But for each person, again, it is an individual question. And to make sure that if you need to get up at X, that you're going to sleep and falling asleep at your sleep time minus X. All right, very important. Most people leave it too late, particularly our teenagers who are getting roughly 1 hour, 56 minutes, an hour and 56 minutes, too little sleep. For adults, it's roughly an hour too little. All right, so we've got big changes to work on there. And then the final question, exploration, source of creativity is what's my quality of sleep? So today we have these trackers. Last night, I was very lucky. I got some good waves of deep sleep. I got a very high score. It doesn't always happen at my age. Right? So when we fall asleep, we first work through the ultradian rhythm of slow wave sleep or deep sleep. And that's your real biological refresher, cleaner, reset for the brain, for the hormones, for muscle cells and the like. Dreaming sleep is also important. And that tends to happen in the second part of the night. The brain is very active in dreaming sleep, whereas it's very quiet in deep sleep. But dreaming sleep is also very important for your memory, for your creativity, for your emotional intelligence, and your recovery from the previous day's trauma. If you're going to bed too late, you'll prioritize the deep sleep and you'll limit your dreaming sleep. So making sure that we have enough time, sleep need, to secure both deep and dream sleep is really useful. And simply tracking is a really good way to find out how you're going with this. I recommend it as an exploration, a point of curiosity, make some adjustments, see if they move. Equally, you could go camping. Okay, the third topic is bounce. And as I said, not bounce back, but the ability to bounce forward fast. The two parts of this. The first is, do I know when my resilience fails? Can I pick it accurately? And the second part is, can I bounce fast? This is not a strategy. These are tactics. They're simple things you do. You recognize the situation, you activate it. It starts in the mind. We are very overloaded, as we all know today. There's way too much, and in the health profession, particularly for doctors, it is a huge issue with distress and mental illness. When we overload the brain, we're pumping a lot of blood and oxygen, glucose up into the prefrontal cortex, which is limited. It is a tiny piece of real estate. It works best really on one thing at a time. So when we multitask, dealing with multiple screens, moving from task to task, unsure about our priorities, this prefrontal cortex becomes overload. We've pushed what's called the task positive mode too hard. and the body takes over. The body knows it also needs to look after your heart and your lungs and your digestion and your skin. So it simply pulls a plug. So 1 minute we're having a conversation together, next minute, gone. In your dreamland, missing what someone else is saying, not paying attention to a paragraph in a paper. You have disengaged. And just to give you a sense of that, I'm sure many of you will be familiar with it. These were judges, all of whom were at parole hearings. Every single one of these judges said, no matter who you are, what you've done, what time you come in, you will get a fair hearing. Well, truth was not so much. For us, if we ever find ourselves in jail, just remember, go see the judge first thing in the morning. The judge's prefrontal cortex is on, task positive, and it drops really fast. And if you go and see a judge and think now about a surgeon or a complex conversation or team meeting, would you really want to do that in the afternoon? Because the judge is going to send you back to jail. And you wonder about our leadership behaviors, our clinical behaviors, if we don't pay attention to this level of confusion and disengage. And the question is, if I disengage my prefrontal cortex, I drop into the default mode, I'm not really fully present and focused on the task at hand. What's running the show? And simplistic, but I think helpful for many people, is we revert to very ancient emotions. So the first thing we're not paying attention is doubt. Have I missed something? Okay, is there a threat looming? You feel a bit of fear, worry, maybe anxiety. If you resolve that avoid reaction, because it was almost reptilian, just as a snake will avoid a human being with everything it can, because the safest thing for a snake to do under human duress is flight. Right? And as soon as it gets away to safe places, it recovers. As humans today, we're getting stuck in these unsafe places. And hence, anxiety disorders becomes one of our biggest dramas. Okay, the defend reaction, imagine the snake now blocked from running away, it moves into fight mode. It wants to strike. Very dangerous for the snake, also very dangerous for humans. And that's where frustration, resentment, anger, and even outbursts can happen. We certainly have seen this recently. Collapse is what a snake does when it cannot fight any longer. It pretends to be dead. It's called death feigning. It's often very dramatic. And for most predators, it's a little awful to see what a reptile will do in those conditions. But in just the same way, with way more subtlety and complexity, humans can hit a collapse reaction. We just feel exhausted. I think in many ways, when we use the term burnout, what we're talking about is a collapse. We've lost our energy, we've lost our focus, emotional energy, our physical energy. In a way, that is more like depression than a separate clinical diagnosis. Now, the point is, and I think, we just need to be humble, but also a little humorous here. This is normal. This happens to all of us. I remember going down through this entire spiral at the age of 15, really beat myself up for weeks on end until I got a sense of what was going on and how to climb out. My experience has been when people can see what happens, they can be much more effective in their ability to bounce. All right, so we don't want the snake brain, the reptile brain in charge. We want to find ways to bounce forward fast. In collapse, we need humility, we need courage. To get out of collapse, you've got to move forward. You've got to be more positive and engaged. You probably need help. And I think that's something many of us clinicians have failed to do. We are too proud to step out and say, look, I'm feeling X. This is going on. Can you help me work out what's going on? When we reconnect with another human being, preferably face-to-face, voice-to-voice, the cure begins. The bounce starts. The diagnosis, the understanding of what's going on is a next big step. And there are now many, many practices which people can choose from. And for some, medication might be the option. For others, maybe working on emotional intelligence, CBT, which we term reframing, or just fixing your sleep can make a huge difference. In defend is different, right? So what we do when we're angry is regret. We get into trouble. When we're angry, the mind works very poorly. So the trick in defend is to learn to step back a little bit. Slow down. Take a few moments to seek to understand this other person so that you can find respect. When we can respect, we can build tolerance. We can build tolerance, we can act with some measure of firm kindness. That is a very powerful place to learn. And clearly in a void, where your physiology is in a hyper-aroused state, your heart rate, your breathing, hyperventilation is a good part of that. The trick is, how do I slow things down? What do I need to do to relax, recover my heart rate, slow my breathing, get a good night's sleep? And we'll go through that specifically. And then I guess as leaders, as professionals, the top two are really, for me, key. How long can I pay attention? Am I someone who can work in 3-minute bursts or 20-minute bursts? Probably somewhere between that. We know that teenagers at the moment, based on eye tracking studies, have an attention span of roughly 18 seconds. For an adult, it's roughly 3 minutes. So a really interesting example, you sit down to deal with your emails. How long do you sit there doing emails? At what point is your response to an email becoming ineffective? If we can ask the question and work out for ourselves, what is my ideal focus time? And you give yourself 100% focus on that task. And then to know, okay, so 10 minutes later, that's about me. I need to take a break. Get up, grab some water, go chat to someone, look out over the local scene, and then step back into the next part of the task. That's what I call serial tasking rather than multitasking. When your mind is moving from one thing to the other, the transition is very, very expensive. Okay, so we lose cognitive energy by moving from task to task. Much better, focus, rest, and find the rhythm. All right, and the flip side, and to guide us maybe through the last couple of these, is to look at, again, those resilience scores and what are the big differences between people who are on the top decile and the bottom decile. And we see worry. And in fact, in senior executive teams, the worry and the rumination number approximates 0. They're just not wasting their time on unproductive thought loops. So remember, worry is when we're thinking about the future in a repetitive and therefore unhelpful way. Rumination is when we are fretting or ruminating about the past, a past experience, and that can dredge up anger or sadness. And we see there fatigue, anxiety, apathy, insomnia, also key topics. So number 4 is focus training. So I suspect this for many of us. And if you think about your children and what you could really do for them, a patient, this focus training has been for 2,500 years the center of the great spiritual traditions. So how do we make that real simple? I think the first step is what you might want to call metacognition. You simply able to step back and say, what's happening in my mind? So you've turned the noise in your head from being a subject of your experience into an object of your experience. So you can identify, I'm worrying about that presentation again. Good. All right, you have noticed your thoughts. And then to learn, okay, I've identified the worry. How do I get back to the present at quieting that down? And that may be through your breath. It may be through making a cup of tea. There are many techniques to do this, but the key is to be able to step back and ask the question, what am I thinking? Then you can identify worry and the associated anxiety, or rumination, the associated anger or sadness. Then we need to work on that capacity to grow our attention span, to use activities such as reading, talking to a patient, working with your team, to give that subject 100% of your focus and to hold it intensely. So you really are training up that prefrontal cortex, and in a way that's a modern form of meditation. As many of our neurobiologists have shown, those who can meditate powerfully really have a superhuman attention span. That's a huge asset in today's world. And then, of course, as clinicians, we all know this, but, it is very easy to get stuck in the detail of a process. Sometimes we have to step back and see the bigger picture. Right? So there's a movement in smart cognition, which is focus on the details, step back, just assess the concept, go back in. And then we can use things like CBT to explore and influence things to the positive. And we know that can work as well, in some cases better than antidepressants. All right? But if we can't start at number one of noticing, quietening our thoughts and being present to the moment, it's very, very hard. I highly recommend Johan Hari's book on stolen focus. He speaks to many experts in this book. It's really entertaining and really reinforces some of what we're talking about today in different and refreshing ways. Right through 2022, this was Amazon's #1 bestseller. So in summary, attention is all you have. Don't waste it on worry or rumination. If you're stuck with worry, get together with someone, make a plan. If you're stuck in rumination, also get together with something. Okay, what was here to learn and what can I do differently next time that arrives? Build yourself into the present moment. Be present for your team, your family, your patients. And I think a third one is very important. We need to start being protective of our mental space. To be a little bit more courageous to turn off the internet, to turn off your phone, to say no to people. This is my flow time. And again, as we know, the brain works from task positive to default mode. You've got to find and you've got to maintain your rhythm. 5, relaxation. Many term this now polyvagal safety. I put it there because it's in healthcare, it's in medicine, it's in education, it's in sport, in buckets, and it's moving into the general public. So my job as a second-year medical student was actually to carve out the vagus nerve, the 10th cranial nerve. It took me 6 months. It's a very complex and the longest nerve in the body. 10th cranial nerve comes out at the base of the brain, runs down through the neck, the carotid, involved in important cardiovascular maintenance, into the lungs, into the heart, all around the heart, sets some of the RSV, respiratory sinus arrhythmia, goes down through the diaphragm, into the gut, into the liver, and all the way into the pelvis. So in the days I did this, we knew the vagal nerve as safe, rest and digest. We also knew that the old part of the vagus nerve is involved in the collapse response. So when you faint, when you burst into tears, when you face a very dangerous situation, simply it'll collapse, vasovagal attack, that is your old vagus fibers, the dorsal nucleus activating. More recently, and thanks to people like Stephen Porges, we've discovered that the ventral nucleus of the vagus nerve is trainable. It only exists in mammals. And those ventral nucleus fibers are connected with your facial nerve, with your 8th nerve and your hearing, with your voice, and therefore your expressions. Right? And when that new part of the vagus nerve functions, physiologically we calm down. Inflammation reduces. We breathe slower. Our heart moves into heart rate variability. It becomes coherent. We also know that our emotions and our thoughts are more controllable when that new vagus is active. And of course, it's critical for connection. Someone who can activate that new part, perhaps 20% of the fibers, is much more able to express empathy. Other people feel safe and confident in your presence. It is activating the right facial expressions, the right tone of voice, the right prosody. Very important step. And of course, as you all know and often forget, it starts with your breath. In a world where perhaps a third of us are hyperventilating and mouth breathing, and then we tell people, take a deep breath. So this all jacks up the sympathetic system rather than activating the vagus nerve. When we exhale, the diaphragm relaxes upwards to empty the lungs. At the same moment, your heart rate slows and your new fibers of the vagus nerve, the ventral nucleus fibers, activate. When we breathe in, the diaphragm tightens gently, the neck, face, chest remain relaxed, and it pulls, and this is of course called primary breathing. When we hyperventilate, we're using the secondary muscles of respiration. In a high pressure job, being conscious of your breath and making sure that you are using that diaphragm well is very, very powerful. There are, of course, many ways to do it. Many of these get publicized, perhaps a little more than is necessary. At the beginning, I suggest a long exhale. Never recommend someone take a deep breath. It's just simply not good advice. You can see the heart rate increase immediately. If you breathe out with a long, slow breath and a pause, you will slow your heart rate, slow your breathing, allow carbon dioxide to come back to normal levels, and you activate the ventral vagus fibers. You can do it with 8 minutes a day. You start to get long, consistent change. That's from Richie Davidson, who has spent his life studying this through various investigative studies. You can use a contemplative practice, your yoga, any form of meditation. Many people are very excited about water, ice baths, a little too extreme for me, but being in water, even splashing water on your face will activate a vagus response. Massage will do it, gargling, laughter, sunshine, vitamin D, even simple things. And of course, you need to make sure someone's not snoring. A simple and not a tough tape like this, but a light tape can help you breathe through the nose more. As you breathe through the nose more, your entire nasal turbinate structure changes. You're able to humidify, warm, slow the air, filter the air, and that encourages the diaphragmatic breathing. Okay, so we suggest a practice. So you feel this intensity. Step 1, light, long spine. Step 2, drop into your body, out of the face place. Exhale, roughly 6 seconds. If you can, a slight pause. When you inhale, it's low and slow. When you do this, even if you're in a meeting with someone, they shouldn't notice. It's quiet. Just try it now. Gently inhale. Exhale fully. Pause. Gently inhale. So you can listen to someone, be part of a meeting, and be doing the slow, even breath. You'll note that breath cycle is roughly 10 seconds. That's about optimal for stimulating the vagus activity. Okay, so, in summary, as healthcare professionals in the demanding world we live in, having to deal with the challenge of people who are suffering and the empathic distress we feel when we see our patients suffering, our colleagues suffering, to feel that compassion fatigue. In my sense, and having been in many parts of healthcare, and serving many healthcare organizations in this resilience thing, I think the first thing is to remember our purpose. Purpose, fulfillment, and flow. In healthcare, we do complex things. That means they require skill. It's also very challenging. So there's no better place to find your way to understand, monitor, and improve your flow experience. Bet in your sleep quality. Practice your bounce. Fast. Have your techniques. For me, for example, if I hit a collapse response, get outside. Look at the view, listen to a bird, experience nature. Does it for me. Work on your focus. Understand what this polyvagal heart rate variability concept means to you. Practice that slow breathing. Try to build 8 minutes a day, and then build it into rhythm. And last thought about this, before we shift to thinking about patients. This for me is one of the most interesting studies from JMA Psychiatry, August 22. It was simply the first good study, in my view, of rhythm. And what they found is people who rise earlier and have a robust exercise program have much better cognition and much less depression. It's a serious improvement. That's the first study that I know of rhythm phenotypes. I think it's a very interesting idea. We know that nature has rhythms, all kinds of rhythms, and we're subject to them. And our own rhythms, for example, the sleep phase, the ultradian, the circadian rhythms, our digestion, hormones, are all linked to nature's rhythms. The more we live in artificial environments, the less these rhythms will work for us. Here's your rhythm of your heart rate variability. You see in the first 3 minutes, this person's chaotic. increases and decreases in heart rate. As they practice that diaphragmatic breath, 4 seconds in, 6 seconds out, you can see through minute 4 and 5, they've reached a really good coherent pattern. The new vagus is activated. That person is calmer physiology, in control of emotions and mind, and they're connected. They're empathic. They're radiating safety, confidence. So in conclusion, really build your rhythm. As professionals in healthcare, we need this, but everyone is different. But somewhere there may be some things that are not negotiable. And I really recommend that's where you begin. This could equally be important for your patients. You know, if someone improves their sleep, everything in the body heals better. Body, emotion, mind. We know the power of exercise. It shouldn't be negotiable. We need to encourage it in our families. We need to encourage it amongst our teams in the workplace. We need to encourage it for our patients. All right. And it starts with you. Walk the talk. Flow time. I think that's something as a professional, every one of us should think about. Where is the time in the day where I'm most productive? Lock it down, protect your space, and do that most important task with your full 100% attention. Okay. And then I guess, you know, just to make the point, this isn't all about you. You know, we've learned through organizations who've done this work, when people and the organizations work with an evidence-based, integral, i.e. body, emotion, mind program that's practical, they get results. As professionals, we have a duty of self-care. We also have a duty of care to our colleagues and our patients. And the organization needs to respond to that, providing assessment, support opportunities. As I showed you in that graph, that group took their resilience ratio up roughly 30%. Over large numbers of people, we get roughly a 27% improvement in resilience. People say they're calmer, they're sleeping better, relationships are working better, they understand each other better, and they're getting stuff done, and flow starts to become part of work. I think there's an interesting question for the future. To what degree might we assess patient resilience? You know, before we do it, of course, with our systemic interrogation, but how about a true resilience assessment? So we can get a sense of the physical, the emotional, the mental, and a sense of that person's life as a whole. And I think as healthcare practitioners, my plea to you, help us move from this disevolution, this degrading of our bodies, the degrading of our emotions, the degrading of our mental health, into a more compassionate evolution. We respect what we can be as humans. We can move up that spiral. We can find a way to be more happy, to be more effective, to be more compassionate. And I think as healthcare providers, this is as important as treating illness. All right, so just to remind you of the diagnostic development model, I will make sure there is a handout available with this. Feel free to have a look at our Resilience Institute website, where you'll find many more detailed molecule articles and models, and you can even practice with this and do the assessment yourself. Look, thank you for your time. I hope you found this useful, and I know it's simple, but it is evidence-based, it is integral, and it's practical. Good luck.